Hi, everybody. Welcome to Dr. Cammy and Karen Go Keto, where Dr. Cammy and I are documenting in this YouTube channel our transition from a basically regular standard American diet to a ketogenic slash carnivore diet lifestyle. And we have been doing this since maybe like, let's say August, maybe really committed August of 2023. And today, Cammy is going to give us some of her test results that she got, and then we're going to have a little chat after that. Cammy, what were your results?
Hi, everybody. Good morning. I had an insulin level drawn, and my last insulin level was 33, which is very high. For those of you that don't know, it should be less than 5, ideally. And my results this time are 28.3. So I was very disappointed about that because it's still very high. On a good note, my heart-specific C-reactive protein, which looks at inflammation, came back and was normal. That had gone from 3.5 to about 2.0. And so that was considered within normal range. Still it's better to have it less than 1.5, but I was happy with that. So all the other results are pending. My lipids and everything else are pending, but I'm thinking that something has to be done differently, right, than what I'm doing in order to get my insulin levels down. So I'm looking at no binging and more fasting. And that's a tough transition for me to make. But when I first thought about it, really, I just had like a mind shift, like a mindset shift about it, where I could look at something else, I could look at something differently. And so that I think is really important to know that that's possible to do. And also, I have to look at my why, because I'm highly motivated to live. And keeping my insulin levels this high is preventing me from being healthy.
Well, Cammy, let's talk about that insulin level. When have you had your insulin level measured prior to starting this transition to a ketogenic lifestyle?
I don't believe so.
Yeah, because it's not in the standard blood draws. If your doctor requests drug testing for your blood, there it usually is not part of it. And it's a fasting insulin test. And I think maybe what's interesting in hearing you talk about it is you have said you want better health, right? One of your whys has always been better health. But now it is more apparent to you that you have some risk factors that are now swaying your motivation, right? Before, we've always talked about you're not being able to giving up binging because you your why is not fully developed. You're not 100% sure why you should be transitioning. Overall, it's not like you've got a reunion that you're going to and you want to drop 20 pounds before you go to a reunion or something like that. So it's sort of always been a general, I just want better health, and it's not a specific goal. And now you have a specific goal of reducing um, that fasting insulin level.
Hmm.
And you came up with it that you're like, okay, I really have to stop binging, because if I don't stop binging, that fasting insulin is not going to go down anytime soon. And you want it to go down a little sooner. Now, quite honestly, Cammy, you said it was 33 before,
Yes.
right? And now it's 28.5. So I would
28.3.
28.3. So I would like to point out that that is a reduction, and
It is. It
I would
is.
have to say it's probably a pretty good reduction, especially because I know those 2 weeks before you did that blood draw, I think you had a couple binges in there, or at least a lot of, eating off plan. It wasn't like that was pristine eating.
No, it wasn't. It wasn't too bad. I'm looking at my calendar, and
Oh, okay.
it wasn't too bad
Okay.
prior.
And, we don't really know how, is a if you did your blood draw like right after a binge, what's the difference versus doing it 30 days after a binge? How long does it take to get those levels reduced? And then how long does it take it to go back up again? So it'll be interesting to see.
And the other thing that I wanted to bring up was that Jeff Cotterman was talking to me about my results and said it would be interesting to see how it was with a longer fast, because my fast was 14 hours. And he was thinking, well, if you went 24 or 36-hour fast and then had the level drawn, what would the insulin level be?
Exactly, because that's sort of how glucose is to some degree, right? You can sort of play with your glucose as to with your food. Um, but then I think at some point the level kind of plateaus, right? So if you fast for 3 days, your blood glucose is never going to go under, you know, 50 or something or 60. So anyway, that's where Cammy's at. We're going to see where she goes. When are you planning on having them drawn again?
I think it depends on how I do with my binging and fasting. I possibly might have it done again right before we go to the conference in August, because this is April. So that would give me May, June, and July. That would give me 3 full months, almost 4.
I might recommend you do it a little sooner.
Oh,
Just, if because you pay for it yourself, right? You pay for it's 12.95, right? So, or roughly 12.95. So maybe because it's motivating you this time, right? It might give you more motivation depending on what the results are, and it's just a better test, right? Because why wait 4 months for unless you're looking at it the opposite, it gives you 4 months to, really straighten out binging and fasting.
yeah. Well, I'll see what Jeff says too, because you would think that with less binging and more fasting, that more weight's going to come off and more inches.
Yeah, yeah. And the thing about fasting insulin levels, for those of you who don't know about insulin, and not that we are experts in this area, so I highly recommend you search for other information in other places. But generally, the insulin hormone is when insulin is secreted and your insulin levels are high, that is a fat storage hormone. And it is so you can't, it stores fat. So as the nutrients are going into your body in your food, it is going to, if it's not going to use the energy that it's getting from food, basically, as energy right immediately, it's going to store it as fat. That's its job. Also, because it's doing that, it inhibits your burning fat. So your fat burning mechanism is not going to be turned on as your insulin levels are high. So that's the struggle.
Which is why I'm really struggling to get into ketosis. I can't get into ketosis with these high insulin levels around. And I think when you're in ketosis, your craving to eat, is lower, and
Right.
you feel sustained for longer periods of time easier. So this is kind of the catch-22 I'm in.
Yeah,
You know,
and the fasting is a good way to jumpstart that ketosis. Even and do it safely, right? Don't white knuckle through it, but and that's one of the reasons why I think you're successful on your OMADs, because you're getting better at doing the one meal a day, and you you there's no complaints. And it's just so funny because so many months ago it's like, I can't do that, and
I
then now
know.
you
Well,
just do it.
I have to laugh because we're having this conversation about no binging and fasting, and I'm just sitting in my chair going, "Wow, I should be really freaking out over this." When you think about how I was in the past with it, and I'm not. I'm thinking, okay, this is something that I might be able to do, and that I'm not real worried about doing. And yeah, so it is. It's very interesting. And I just wanted to mention too that I've done, like, the last 3 days, I've done one meal a day and been very successful at it. And I think it's a lot of it is that mindset shift that I'm going through, that with these news of this high insulin level that's still there.
Yeah. Or possibly it's the fact that you've reduced your insulin already that's making you feel, physically it's having an effect on you and it's making you feel better,
That's possible too.
right? So, um, anyway, all right. So we are, um, was there anything else that we wanted to cover, Cammy, or?
I don't think so. We're going to see how I do with no binging and fasting.
All right, so maybe our next one is we're going to talk maybe a little more about our OMADs because we both have been doing OMADs. So we'll get back to you guys. I hope you're having fun watching us. And if you're following us and doing your own journey, let us know. Subscribe, write in the comments, and tell us what's up.
Thanks so much. Have a good day.